I'm going to give pictures of three babies who demised within few hours after delivery. One of the babies had been diagnosed antenatally at 31 weeks and the other two babies had not been diagnosed antenatally. I'm giving three questions. 1. What's the diagnosis? Second question, what are all the antenatal findings to diagnose this? Third question is, give me the circumstances when the diagnosis might be missed antenatally. So the three questions are, what's the diagnosis? What are all the antenatal findings to diagnose this? And the circumstances when the diagnosis might be missed antenatally. Here I have to immensely thank my mentor and senior Dr. Manohar sir, who is the founder and director of Doppler Scans, Madurai, who has given the antenatal images for the discussion. Thank you very much, sir. Here we shall go to the case now. The diagnosis is congenital ichthyosis, harlequin fetus, which is the most severe form of congenital ichthyosis. Here the final diagnosis of the three newborn babies is harlequin type of congenital ichthyosis. All the three babies were delivered in our hospital. The first baby was diagnosed and had been diagnosed antenatally by my mentor at 31 weeks, and so this was expected. As the second baby was not been diagnosed antenatally, and with the antenatal scans done elsewhere at 8 weeks, 18 weeks, 24 weeks and 36 weeks, and then admitted here due to abdominal pain and was delivered here. This was a real shocking experience in our hospital, and we were not blamed as no antenatal scan had been done here. But the third baby had not been diagnosed antenatally, and the antenatal scans, initial antenatal scans done elsewhere at 8 weeks, 20 and 25 weeks, and admitted in our hospital with anhydramnios due to premature rupture of membranes at 34 weeks. Okay, now we'll discuss about the antenatal diagnosis of harlequin fetus with the images detected and diagnosed and discussed by my mentor, Dr. Manohar sir, many years back. So the findings are, the non-specific finding is the mild polyhydramnios with echogenic particles after 24 weeks. Second one is the facial anomalies, very striking findings. One is marked eyelid edema with eversion called as ectropion. The second one is marked edema of the lips with eversion called as eclabion. The third one is protruded tongue. And the fourth one is absent ears, very important because it's almost there in more than 90% of the cases. Fifth one is flat or absent nose. These findings could be detected usually after 26 weeks. Now we will go to the limb anomalies. First one is persistent flexed attitude of fingers and toes, which might be detected after 24 weeks. The second one is short feet, might be diagnosed antenatally at the early stage, probably at or before 24 weeks, with measurement of femur foot ratio done routinely during anomaly scan. This might be the first suspicion which could be detected at the earliest stage. Last one is the skin assessment by high resolution ultrasound, which shows highly thickened fetal skin, usually detectable during or after late second trimester with ulcerations and cracks. 3D gives facial features much better than the routine 2D scan. Harlequins means costume of a clown, and you can please see the picture of the clown called as harlequin, and almost matches the pictures of the babies, mainly the dramatical appearance of the face of the babies. Second one, ichthyosis means thick crackled skin, as in scales of the fish, is called as ichthyosis. Now please pause this video to see the characteristic features of the harlequin fetus briefly discussed and highlighted in the table. Please go through that, and please pause the video to see the typical features. Lastly, we will discuss about the circumstances when the diagnosis might be missed antenatally. So this could not be routinely diagnosed before 24 weeks. It's very important. It's very difficult to diagnose this before 24 weeks unless otherwise specified by the family history or by the clinicians. Second one is, this is very difficult to detect in breech-like, especially with spine persistently anterior for a very long time. Again, it's very difficult. Third one is, it's important this might not be diagnosed in fetus if the fetus has fixed cephalic lie in late third trimester, especially at 36 weeks, where the initial scans were normal, and you're doing the late third trimester scan where it has fixed cephalic lie, and when there is oligohydramnios or anhydramnios, again it is becoming very tough to detect. Very importantly, most of the mothers nowadays have very thick abdominal wall, which makes it difficult to detect a terrible facial dysmorphism. To all the viewers, I sincerely thank very much for your patient hearing. It will be really helpful to give your opinions and your feedbacks in the comment section. Take care. Bye bye.